Hello, class. This is Joseph Horner, just checking in with you. I'm getting a lot of questions lately about the clinical degrees for psychology and what the heck the difference is between all of them. This is a common thing, but I finally decided to just make a video where hopefully in 15 minutes or so here we can explain the differences, because it is kind of complicated. There are many differences in mental health workers and people who are licensed to do those works, and people who can, and many different differences in the training paths to get there, so I hope this is helpful. This is my opinion information. This is not taken from an official source, but just from what I've observed over the years. So please look up any more information on your own if you have any questions, or you can give me a ring. Either one will work. Just don't take this as the only possible answer to any of your questions. My experience mostly comes from a couple different states, and my experience with that, and licensing laws can vary between states on what you can and cannot do. So don't be afraid to look up where you want to live and get some information. So what is the difference? So there are many different opinions on what mental health worker means in general. So I just listed a few of the jobs here. Most of you, when you think about it, first you think of job as a counselor or doing counseling or psychotherapy or whatever you want to call it. And that's the first job most people think of that you could do in a clinical context in a mental health, as a mental health worker. Another one is testing. So there's a psychological testing course at BYU Idaho. And that introduces this, and then it talks a little bit about it. This is what you think about with things like IQ tests, or things like helping test for learning disabilities, or for autism, or for all those things you hear about, neurological testing. So neuropsych is a part of this testing, and you can do it for many different areas, including courts, which is like what I kind of put down here in the little part here, is that court is one area, but there's also things like schools, or testing for private practice, or things like that. So similarly, the aforementioned counseling can be done in a lot of different settings. You can work for a lot of different people as a counselor. Case management is a common mental health function, which is where you work to help connect people to the services that they need and help manage their case. You're not doing counseling in particular, but you are helping people usually with mental illness or substance use problems get the services that they need. This can be done in a lot of different settings also. Giving out medications. Mental health workers, some give out medications as part of their job. And then, of course, research and teaching and things like that at an academic level are also something done in a lot of different areas. So what are the different degrees? So the first is the common set you probably know about, which is degrees in psychology, counseling, or clinical psychology. First is a bachelor's degree, which is what a lot of you are working towards. What does a bachelor's degree get you? Well, with any kind of degree, you can do case management. That's basically what it does. And there's other jobs in mental health that you can do, such as tech work, which is working at a hospital as a psych tech. You can do that. You can do other jobs in mental health that you either need a degree or don't even need a degree to do, working for hospitals and things like that. But the biggest thing with the degree is case management. In Idaho, in specific, and a few other states, there's other mental health jobs. One's called a psychosocial rehabilitation worker, so PSR worker, that you can do with a bachelor's degree. I did that myself for a little bit, where you help, it's this form of case management along with some behavioral interventions that you do to help out. So you can work for the state, you can work for hospitals as a tech, you can work in rehab facilities for substance use. You can do a whole plethora of things with the bachelor's level as a case manager. Most people, though, are dissatisfied with that as a long-term outcome, at least for full-time work. They go all the trouble to school, so they go to other degrees such as master's, PhD, and what's called a PsyD, which is a specialized degree, which we'll talk about in a minute. So let's say you want to do counseling. Which one of these degrees can you do with counseling? You can do counseling with a master's degree, a PhD, or a PsyD. Any of those three in most states, again, I'm talking about most states, you can do counseling. Even in Colorado, you can do counseling with a bachelor's degree. Call yourself a counselor. Now the question is, where can you do counseling? It might vary by what degree you have and what license you get with that degree. So for example, here in Colorado, you can do counseling, like I said, with a bachelor's level, but that's not common in other states. And you can bill insurances for it. But, for example, I work at the VA Medical Center. You cannot do counseling at bachelor's levels here. You have to have at least a master's or a PhD level. And they don't typically see a lot of professional counselors, which is a master's level. Sometimes they're called LPCs, so licensed professional counselors. You don't see many of them working in a setting, but you do see them out there a lot in private practices or hospitals or other settings. Depends on how they're licensed from state to state. In some states, LPCs have a lot of license to do a lot of different things. In other states, it's limited. A PhD, on the other hand, in almost all states is qualified if you pass and get the license to be a licensed psychologist to do counseling. So what about testing? Generally, in most states, you need at least a PhD or a PsyD to do counseling. Now, there are some testings that you can do as a master's level, usually to inform you as a counselor. And it varies state by which one you can do it. So, for example, in a lot of states, you cannot do psychological testing for intelligence testing and write the report without a PhD level degree. However, most PhD level degrees can employ somebody with a master's level or even a bachelor's level or even less to do the testing, to actually administer the tests, and then they write the report or interpret the test, as it's called. So that is something that is significant with that. So if you really like testing, want to get involved with court cases, just remember, anytime you deal with court, with anything, they love degrees and accolades and things like that. So most people who work in court professionally, who write a lot of assessments, again, who may evaluate for, let's say, something like a convicted sex offender, or may evaluate the sanity of someone to stand for trial. Generally, those people have one of the two doctoral degrees. So at this point, you're probably asking, what the heck is the difference between a PhD and a PsyD? And that is a very good question. There used to be a bigger difference, but now clinically, what you do in your job, the difference between these two is very minimal. They can all do all of these things that we've talked about so far. And they're both pretty accoladed to do research and other university activities like teaching. However, traditionally, those who get a PsyD are not as seen or engaged as highly in the regards of research. Now, you can always do research, but it may be harder to get a job, for tenure track research if doing a PsyD as compared to a PhD. And traditionally in the training, that is the biggest difference too, is you get a lot more research in, a lot more training and research as a PhD. Because, in every other science, a PhD means you are trained in research primarily. Both of these two degrees, generally you have to do a dissertation, which is research. But even master's degrees, usually you have to do some kind of project. Though some masters in counseling psychology, you don't have to do a full-blown thesis. It is more of a project to get it done. So what does that mean? It means that if you want to work in a university full-time, tenure track, you probably need one of these two, and maybe a PhD is the most common thing. So why go for a PhD over a master's in psychology? The biggest reason is two. One is this, testing. Like I said, in a lot of states, you can't do all of the testing. If you want to be a consultant, if you want to test for things you need to be a licensed psychologist, which requires one of the 2 PhD level degrees. However, you can be a licensed professional counselor at a master's level, which lets you do the counseling in the states that you can get to be a licensed professional counselor. So that's the biggest thing. Do you like testing? Do you like research? If so, think about getting a PhD. That's a big thing. But wait, we're not done. There's even more degrees to help you work as a counselor or in mental health. One is social work. So social work, in a lot of states, you can get licensed at a bachelor's level as a licensed social worker. Or just a social worker, depending on what the state labels it. What does that allow you to do? You can definitely do case management. You can do work in a lot of different settings, such as hospitals or any other place where they need to fill out paperwork and connect to services. I know some social workers who work in hospice, and they work in all these other different types of mental health as having to do with it. What can you not usually do at a bachelor's level? Just the same as psychology, you can usually not do counseling or testing at a bachelor's level. Can you administer the test? Sure. Can you give advice? And you can give professional advice within your scope, but that doesn't necessarily mean you can do counseling. So, what else can you get? You can get a master's and get licensed as what's called an LCSW, or a licensed clinical social worker. This allows you to do counseling in most states. This allows you to do testing in most states. So, what is the difference? Why would you get this over this? Well, for one thing, remember, PhDs and PsyDs can do the most testing typically and can be certified to do it. But it's two things. One is the training, and the other is the application. So professional groups defend and get legislation to be able to give rights for what you can do with each one of these degrees. So remember, LPC, LCSW. The vast majority of people who do counseling nowadays have one of these 2 degrees. And they're the ones that really do most of the counseling out there in the world today, in a majority of settings. But it can vary state by state depending on how much professional organizations have pushed in legislation to allow them to do. LCSW tends to be the most general, or the most broad, in both training and an application. The Social Work Union is really, really good at pushing to get generalized rights to do counseling. Generally speaking, again, PhDs in psychology that are licensed psychologists can do all of these things with a general, everywhere that they go, because they have been around the longest since World War II. So, but at a master's level, only 2 extra years of school plus some on-the-job training, this tends to be the most universally accepted degree is an LCSW. And I see that we're almost out of time, but I do have more to say, so I'm going to cut this off, and I'll do a second video to finish this up. Talk to you in a few minutes.